Does anyone seek to be recognized on the bill?
Mr. Chairman,
For what question does the gentleman from Virginia seek recognition?
I seek recognition to speak to the bill.
The gentleman is recognized for 5 minutes.
I thank you, Mr. Chairman. We buy health insurance so that if we get sick, we are not financially devastated by the high costs associated with the health care we receive. That said, oftentimes costs are just too high. With respect to prescription drugs, we have heard in our hearings that the so-called incentives from PBMs to insurers can actually lead to patients paying higher prices for certain medicines. It can even mean a patient could, in some cases, pay more for a medicine than the insurance company with whom they have coverage. Using competition to lower prices makes sense, but using competition to raise prices by limiting access to the marketplace is unconscionable. That's why I introduced the Fairness for Patient Medications Act to ensure that insurance companies and PBMs cannot charge patients more than the price they negotiate themselves for certain drugs. Under my bill, the Secretary of HHS will use existing reporting data to certify a highly rebated drug as a drug whose rebates discounts equal 50% or more than spending on the drug. If the drug is highly rebated, a patient would not be required to pay more than the insurance company is paying for the drug from the previous year once all the discounts are accounted for. For highly rebated drugs, patients won't pay more than the insurer pays for the drug. This is common sense legislation. Now you got to follow the bouncing ball because it does get a little complicated at times. One, PBMs can pit manufacturers against one another to see who will offer them the largest rebates for competing medicines. The winners get preferred access to patients enrolled in health insurance plans serviced by those PBMs. So, manufacturers are rewarded with market access by making their list prices for a medication higher. Higher prices on those medications allow the manufacturers to give the PBMs higher rebates so that they can say, look at the good deal we're getting you. Three, and following that bouncing ball, but even with the rebates, the PBMs are often paid a percentage of the list price. So even with the rebates, because the list price is now higher, the PBM makes more money. And even though the final price of these drugs after rebates may be significantly less than the list price, to some patients, the list price actually matters. Some health insurance plans actually base what a patient pays at a pharmacy as a percentage of the drug's list price, and some still pay cash. This bill will ensure that patients receive the savings from these rebates and not the PBMs. During our legislative hearing on April 26th, the Pharmaceutical Care Management Association, that would be the trade association for PBMs, told me that they actually were aware that sometimes patients pay more than the price the insurers are charged in certain circumstances. As an example, according to one estimate, a 5 milligram oral tablet of Eliquis, a common blood clot medicine or drug, has an estimated net price after all the rebates of $73.14. This should be the maximum price that a patient has to pay then. Instead, the drug has an estimated retail price of $387.39. This is the cost the insurers can charge because of a rebate system where middlemen, PBMs, use this system to raise list prices of drugs. In other words, if your copay were 20% of the list price, you could actually pay more in so-called copay than the medicine costs your insurer. This bill would ensure a patient with insurance would not pay more than the net price paid by their insurance company. This bill is a matter of simple fairness. It is, as my colleague from Georgia said earlier, there is no silver bullet on dealing with PBMs. This is just one small step. But I hope that we vote on this bill favorably today and get it out of the subcommittee. If If we need to continue working with CMS, that's fine, and we can certainly work with my friends across the aisle to get the bill into a good spot to fully address the issue at hand, but we must deal with this issue where people are taking advantage of our constituents to put cash in their pocket with no gain. I yield back.
The question now occurs on forwarding H.R. 3285 to the full committee. All those in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it, and the bill is agreed to.